Yeah, I always feel like it's harder for women in medicine, especially if you want to have kids.
Yes.
Yeah, because I don't care what anybody says. Kids need their moms around. Not all doctors are created equal.
It's true.
So patients have to do their due diligence.
They do.
Have to, and they should get second opinions.
That's the hard part about this podcast is that we have to be on our bestest English.
Yes.
Yes. Oh,
and I'd be all grossed out, like, ugh.
I still can't watch the TV ones, like the pimple popper. Oh.
I always thought that.
I don't know. That freaks me out.
Welcome to our podcast, From the Inside Out.
Aloha mai kākou.
Where we're going to talk about common medical issues and speak with experts in the field, particularly within the state of Hawaii, to answer some of our questions, for example, about any medical issue that comes to hand, and even for things that are outside of the body. That's the title, From the Inside Out. I'd like to introduce my co-host, Dr. Lehua Perry, who is a practicing private practice OBGYN here in Honolulu, Hawaii.
And welcome Dr. Cass Nakasone, who is one of the premier surgeons. I'm sure everybody out there has had some family member helped by Dr. Nakasone out there. He's at Straub. He's very good at what he does and a very prominent physician, a respected physician here in Oahu.
Well, that was a little more than I expected.
I know, wasn't it? That was a lot.
So Dr. Perry, can you tell people a little bit about your practice and what it is that you specialize in? And
Sure. I'm a lowly generalist. I'm an OBGYN. I just specialize in general OB and GYN. Especially women's health. That's what we do mostly. We only see women. I am a private practitioner, which means that I'm not employed by a hospital. I'm community-based and service my patients as a private practitioner.
And is there any one particular area in OBGYN that you have a focus on?
Not necessarily. We kind of take the whole spectrum. So I do focus on anywhere from the 12-year-old crowd all the way up to the postmenopausal crowd in their 80s and 90s. So How about you?
Well, first of all, I'd like to say that I don't think you should refer to yourself as a lowly OBGYN because as far as I'm concerned, you're taking care of something that is very, very, very important to many men. Yeah, and we find that to be actually something very valuable. So
yes, women are the heart of every family, I think. So
it's true. Mm-hmm. It's true. I might have been referring to something else, but we won't go there. Okay.
How about you? Well, you're a specialist in...
So my specialty is in orthopedic surgery, but I'm subspecialized in just doing hip and knee replacements.
Okay.
I still do have to take general call at Straub Medical Center. I, on the other hand, am an employed doctor with Hawaii Pacific Health, and I work out of Straub Medical Center, where I really just focus on doing hip and knee replacements for patients who need it, which is mostly the 65 plus crowd, but there are obviously patients.
Do you see any pediatric?
Well, we've done,
ages?
I think.
Or younger?
Yeah, we do.
Yeah.
Like the youngest person I've done was 14 years old.
Oh, wow.
Yeah, but these are very unusual.
Unusual.
Yeah, unusual circumstances, yeah.
I see. Oh.
Yeah. Most patients the average age for my patients is 70.
Wow.
Based on our studies. So.
Oh, that's cool.
Yeah.
How did you get into orthopedics?
My background was actually, I started off as an engineer. Oh. So my background was in engineering. I did like a 3-2 engineering program with Whitman College where I had to.
Oh, Whitman.
Yeah, Whitman.
I didn't know you went there.
Yeah, I went there because there was no way I was going to get into Caltech from high school.
You want to go Caltech?
So I did this 3-2.
Oh, wait, we got to ask the question though.
Yeah.
Where'd you go to high school?
Oh, I went to Punahou from 9th grade to 12th
See, this is why
grade.
it's good because, you're an employed physician. I'm private practice. Yeah. You went to Punahou.
Yeah.
I went to Kamehameha.
Yeah.
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 So we have a lot of...
exactly.
Not in commonality.
I did start off in public school at Kamiki Intermediate. So.
Me too. I went Wilson, home of the Dolphins.
Oh, I was at Wailai and then Kamiki Intermediate.
Oh.
Yeah. And then I was very upset that I was going to actually go to a private school. But
oh, were you?
Yeah.
What grade you got in?
In 9th grade.
Oh, 9th.
Yeah. So I started in 9th to 12th grade.
I went 7th grade.
I pride myself on bringing the pidgin language to Punahou.
I know.
in ninth grade.
That's the hard part about this podcast is that we have
Yes.
to be on our bestest English.
Yes.
Yes. We're trying hard.
Yes. But so
Also Whitman.
Yeah, and when did you know you wanted to become a doctor?
I didn't. I didn't know for a long time. I just didn't think I had the brains for it.
I never planned to go into medicine myself.
Yeah, you wanted to be an engineer?
Yeah, so I was in engineering, and I did that 3-2 engineering program, and then I actually got my master's in mechanical engineering from Stanford.
So you went from Whitman to Stanford.
I went from Whitman to Caltech. So
you did get into Caltech.
Yeah, well, it was like a 3-2 engineering program.
What does that mean?
Means like they had a program where, if I recall correctly, Whitman had a collaborative program with California Institute of Technology. So if you did apparently well enough at Whitman, then you could go to Caltech and get your engineering degree. So I got a physics degree and an engineering degree.
Which helps in
5 years.
orthopedics.
Yeah, and then I went to get my master's in mechanical engineering.
So you took
at
the long
Stanford.
route around too then. You weren't one of those that just got into medical school, like 4 years college.
Yes, but
then got in.
luckily, the whole engineering part was pretty quick. My master's program was just a year, so it didn't take me too long.
Me too.
And during my master's program, we were working with doctors at Stanford University, right, as engineering projects, and I was trying to decide what to do after that, if I should go on or what, But I wanted to return to Hawaii.
But you wanted to do like something in the engineering field?
Yeah, I really had no idea what the heck was going on, right? I mean, I knew I wanted to do something in engineering.
But you knew the ladies love engineers.
Well, that's what they told me, but apparently they don't love them enough because at Caltech it was like a 5 to 6 to 1 boy to girl ratio, right? So I guess they don't love them that much.
Better at Stanford though.
Yeah, I think it was. I don't know what the men to women ratio was at Stanford, but there were more women at Stanford. Yeah. But anyway, I didn't know what to do. So, and the guy I was working with just said, "Hey, maybe you should think about going into medicine." And I was like, "Oh." So anyway, long story short, it was a poorly thought out decision that seemed to work out, and I came back home to the University of Hawaii for medical school.
Oh, nice.
And then did residency here at the University of Hawaii, and then I did my specialty training at University of Southern California.
How many
just knee and hip replacements.
How many years is your residency?
Residency for orthopedic surgery is 5 years.
Oh. Yeah, for people that don't know, we have to go through 4 years of medical school, and then usually a residency. So you're a doctor, but you're in doctor in training for a few years. And then you can, like orthopedics, right? You have to take extra.
Yeah. Well, for orthopedics, I think any surgical residency program is at least 5 years.
Yes.
Right?
Well, OBGYN is 4.
Yeah, OBGYN is a little bit different.
A little different.
Mm-hmm. So like for you, what happened in your pathway? How did you decide to go into medicine?
Well, I thought I might want to do it in college. I went to Kamehameha and then I went to college here. But it was kind of a far-fetched idea. I didn't think I could do it. Especially Native Hawaiians. There's not a lot of Native Hawaiians in medicine. You don't think that you can do it or see a lot of people.
And I think at that time there probably was not really as many women.
No,
right,
and not a lot of women Native Hawaiians.
Yeah.
So it was hard to kind of fathom that I could do that. And it was a lot of work trying to figure that out. So I graduated in 4.5 years from UH, which is a feat because UH is hard to do that. And then I minored in biology and Hawaiian language. And then I actually majored in sociology, medical sociology. And then I was working at Kaiser. My auntie was a nurse there. Shout out to Auntie Joni. She was working in the CV, ICU, and CCU. And so she
what
got
is that?
me
Sorry for
cardiac unit, ICU unit.
Okay.
So she got me a ward clerk position there. She says, if you want to go into medicine, you got
to start somewhere.
Start somewhere and just see if you like it, number one. So I worked there for many years. And one of the docs there, Dr. Samina Khan, she was the ICU doctor there. And I told her I really wanted to go into medicine, but I just don't think I could do it. She's really encouraged me. I took the MCAT, did the whole thing, applied, and I got waitlisted.
Yeah, me too.
You too.
Yeah.
I got waitlisted. And so at the time, you had to go and talk to the dean. So I asked the dean, is there anything more that I can do? He said, these kids nowadays are so intelligent and have so much background that, you have to be competitive. You have to go get a master's. So he told me, go get a master's from somewhere. So master's. So Dr. Khan helped me to figure it out. And that's how I ended up in Columbia.
Okay.
I got my master's in human nutrition, which is basically like a biochemistry.
Okay.
And then I applied again and I got into the Amy Ho'ola program here.
So how old were you when you
I was old.
Like how old were you when you got into medical school?
I think I was like 26, 25. I don't even know. I went to
I think I was also
25 or 6, yeah.
I think I was
Kinda
24.
older.
I think I was 24 when I got into medical school.
'Cause
so I wasn't older. I mean, at that time.
Because you did your master's too, right?
And then I had to take a year off to take biology and organic chemistry.
Oh.
So the only 2 science courses I didn't
So
take.
that was
right?
the same, yeah. I had to do.
Yeah.
So I did 4 years of college, 4.5, and then I did a year and a half at Columbia, and then I did another year for EME,
Yeah.
and then I got into medical school. So I was one of the older ones.
Yeah.
Yeah.
I think it was good though to be a little bit older. You have a
think
little
so
bit more life
too.
experience. Yeah.
Yeah. We had a lot of life experience, and
Yeah. I was always wondering how these young guys go straight
I
from.
give them credit. Yeah.
Well, not only that, but they don't have any life experience. I was in medical school thinking, how are you going to talk to your patient about erectile dysfunction when you haven't even had sex yet, right?
Yeah. It's true.
Right?
Yeah.
I mean,
Life
anyway.
experience makes you a better doctor.
Yeah.
For sure.
Yeah, because you can understand
Empathy.
things more. Yeah. Exactly.
Yeah.
It's funny. When I applied to, I don't have any doctors in my family.
Yeah.
So, there was really nobody to give me advice about what to do.
Mm-hmm.
And I remember, because, obviously all Asian parents want their kids to be doctors.
Right.
So I remember people used to ask me, oh, don't you want to be a doctor? And I'm like, I don't want to be a doctor.
Yeah.
Right? Why would I want to do that? Like, I used to watch That's Incredible, and I'd watch surgeries on TV, and I'd be all grossed out, like, ugh.
I still can't watch the TV ones, like the pimple popper.
I always thought that.
I don't know. That freaks me out.
That's why I thought I couldn't be a doctor. Because I thought, if this grosses me out, I can't be a doctor. Right. And then I go into orthopedics where blood and bone
everywhere.
is splattering all over the place. Yeah. But,
Oh, that's
yeah,
cool.
and then I only applied to a few medical schools because I really had no idea.
Yeah.
I got waitlisted at UH, but I was lucky enough to get in that first year off the wait list.
Oh, so you got in off the wait list.
Yeah.
That's pretty good.
Yeah. So it was I was kind of lucky, and then I had no idea what specialty I was going to go into, but I knew that I had to do something with my hands because I work with my hands, and just mechanically,
Right.
Engineering wise, I thought I had to fix something. That's just my personality. Right?
Yeah.
I didn't want to do something where I could only manage you.
Right.
Right. It was either I want to fix you or not, because otherwise, if I can't cure your schizophrenia, like why am I gonna? I mean, it's not worth it for me. So, but that's just my personality, right?
Yeah.
Everybody has a different personality, so.
I remember doing rounds, and then you remember it was handwritten back then, right? And then you'd have to do problem number 17, right?
Yeah.
And then write your note about it. And I was like, oh, this is a lot to be a internist.
I thought I was gonna enjoy OB,
Well, you did it?
probably for the wrong reasons.
Oh.
But it was not enjoyable. OB was
What didn't you like about it?
you couldn't sleep.
Yeah,
The
no,
OB,
yeah.
OB rotation was the worst.
There's no sleep.
Somebody was screaming and giving birth
Yes.
all night, every night.
Yeah.
And I feel like, as a student, you couldn't be sleeping,
No, you can't.
right? You're the one that's supposed to be up trying to pretend like you're all
You got to
into
push
this.
with them. You got to, it's a whole
Exactly.
deal. Yeah.
Anyway, that was... I feel bad for OBs because it's like they can't get any rest.
I feel like OB is great for like the ADD person, like we never have the same day twice. We do inpatient, we do outpatient, we do surgery, we do primary care. I feel like OBs get a bad rap because we don't get a lot of credit, because what did they say? Like good at nothing, does everything. I don't know. There's a saying about that, but the opposite of jack of all trades, right?
Yeah.
But
Oh, yeah. You mean like jack of all trades, master of none?
yes, so I feel like we get a bad rap because nobody respects, the OB, but we do a lot.
Yeah.
And we follow them from birth to menopause, right? And we get to be a part of the family.
Yeah.
and all the kids being born. It's really cool.
Because I guess you keep your vagina for life.
You do. And you got to keep her nice. You got to keep her.
That's what I say. That's what I say. But anyway.
Oh. How about orthopedics though? It's really weird in medical school that we don't even get. I've never been in an orthopedic surgery.
Yeah, we never were.
Isn't that strange?
Well, at University of Hawaii, it was really more of a primary care general right type of education. So it was, I had to, we really had to do extra to get exposure to orthopedics.
Do you think like that your engineering background just led you right into it?
Yeah, it was. Yeah. It's just been very fortuitous. It's perfect for me.
That's amazing.
Yeah.
And I think being a little older, you kind of know, yourself a little bit better.
I think so. Yeah.
And like what you want to do.
Yep.
I don't know. I did it the opposite way where I ruled out everything I didn't want to do.
Yeah, I was kind of like, actually, I liked everything. At some point, I thought I was going to be a pediatrician. Then I thought I was going to go into internal medicine. Then I thought I was going to be a psychiatrist. But I knew surgery had to be something for me because that was the only thing that I really liked the most.
Yeah. I love the surgery part.
Yeah.
But I love the baby part.
And I think for guys, or at least for me, I don't think we're good multitaskers. So I like just being focused on one thing at a time and just being able to complete this task and then complete the next,
Yeah.
Yes. I think that's, for me, it just suits me.
Yeah. Do you think that you would do anything else if it wasn't orthopedic surgery? What would you do?
Man, I don't know. I think it would be still something in surgery.
Yeah.
Yeah.
Oh, that's interesting.
So it would be something I have to mechanically think about, and that's what
hands-on.
I like.
Yeah. What kind of hobbies do you have?
Kind of hobbies I had? Well, I had a lot of hobbies. I used to be really into spearfishing, like blue water spearfishing.
That is super cool.
That was really fun. Obviously some type of exercise like weightlifting or something has always been something that I've always done just to keep myself in shape. I can't really sit still. Then I kind of got out of, spearfishing, and now I'm into like shooting sports. So, I'm just lucky enough that I have a friend who has a range. And so we can go to his range and we can train a lot and whatnot. So that's sort of been my most recent thing. But of course, having kids, two kids that are now in college. Now I have a little bit more time.
They're both now in college. What are they going to get into, you think?
I don't know. My son's doing biology, but I'm not sure if he knows exactly yet what he wants to do. My daughter's very artistic, but she's studying psychology, so I don't know what she wants to do.
Cool.
What about you? How do you find being a woman in medicine?
Yeah.
With two kids.
Oh, it's not fun.
Yeah. Right. That's hard.
It's hard. Private practice, being a woman, kids, I think all of those things are hard.
And are you working full time now?
I work part-time. So basically I work about 4 days a week. I've really had to scale back on my deliveries just because with the kids, there's no way.
Yeah.
And being in private practice, it's really hard because the hospitals and other entities put a lot of like constraints on us. So say you're in labor and we have to be at the hospital, we have to be within 15 to 30 minutes of the hospital. So we have to just drop what we're doing at any point of any day, no matter what we're doing, and tend to a patient in need. So ER for any GYN complaint, OB. So it's really a rough gig.
Yeah, I always feel like it's harder for women in medicine, especially if you want to have kids.
Yes.
Yeah, because I don't care what anybody says about, that kids need their moms around more than they do their dads.
Yeah.
Like I can be at work. Like when I was growing up, my dad worked a lot because, he was, he just had to work a lot because it's not like he made a lot of money until he changed something in his career, which allowed me to go to Punahou.
Yeah.
But I don't remember. I mean, he was gone a lot, but that was just the expectation, right?
Right.
Dad should be working. Right.
But your mom took care of most of everything.
Yeah, but my
else.
mom had to work too, right? Because it's not like they had the luxury. Too. Yeah. So my mom was a teacher.
Oh. My dad too.
My mom was a special ed teacher, so she used to talk to me real slow.
God bless your mom. I don't even know how she does that. That is God's work right there.
Yeah, and teaching is hard.
It's hard.
Because they have to do a lot of work outside the class.
And it takes a big heart for special ed too.
Yeah.
Man. Oh.
Well, I think for all teachers.
All teachers.
Well,
my dad's a
teachers.
college professor, so he got it a little bit better. But yeah.
But I think it's hard to manage family and work.
Yeah, it's
because
really
I feel
hard.
like it's it's not like people say, oh, you don't want to take your work home with you, but even if I'm not on call, if somebody calls me and say, hey,
right.
somebody's auntie fell down and broke her hip and they want you to do the surgery, I can't say no.
Right.
You're not going to say no.
Right.
So, that means that you might have to leave the birthday party or you might have to do not be there when you thought you were going to be there. And that's just the way it is.
Yeah. Yeah.
So
it's something just to juggle.
I hope my kids understand that.
Yeah. Yeah.
But I'm sure they will in time.
I hope so too.
Yeah.
My son, it started to affect him. So I had to really scale back, but.
Yeah. You have any advice for women? Because nowadays, medical schools, it's the opposite now. There are more women in medical school. I think it's like 60-40, right? 60% women, 40% men.
Yeah.
And I think it's about the same for colleges as well.
Oh, is it? Colleges
I think so.
too?
There are more women in college than men.
Wow.
But I don't know. What advice? Because I have a lot of students that always ask me for advice about the medical field. And
it's so hard.
How do you advise women? Because I always ask them that question that, do you want a family? And I think, I don't know, me personally, I think having a family is very important to most people.
Most people, yeah. And I feel like it's hard because a lot of the specialties require, if you're going to go into a surgical specialty, for sure.
Yeah, it's difficult.
Yeah. I unfortunately tell them to pick another lot in life. Like, go be a dentist, go be something else. I don't know. It's just hard. I feel like if that's what's in your heart to do, like follow your bliss. But at the end of the day, medicine is not what it was, I feel. And the reasons why I got into medicine is kind of, I don't know. It's different once you're in it. Because it's hard. It's hard.
Yeah. Mm-hmm. I think that's also why we're also a little bit, and this is not a knock on anything, but I think there are a lot of women that go into medicine.
Yeah.
And then they find that they have to work a little bit less.
Yeah.
So even though you have more women doctors.
Right.
In the end, there's less doctors in the field because more of them are taking a half-time position.
Well, the system isn't, very conducive to women at all.
Yeah. Or just to work in general.
To work in general.
I mean, for that balance, because you have to be. Obviously, and I think for most women, if you have kids, you want to see your kids. Right?
You do, yeah.
So it's
and
not
be there for the birthday parties.
Yeah,
and
exactly.
Kids, I can't be like, oh, gotta go. Sorry, dude.
Yeah, I think that's the hard part. So it's a little bit, I think in that regard, a little bit easier for guys, right? It's easier for us to be away from home. But anyway.
Yeah, it is. But I would say, if that's what you want to do in life, it's hard because medicine, it takes a lot of grit.
Yeah, it does.
And it takes a lot of your time. It's a very selfish profession.
Yeah, I would agree. I would agree with that as well.
So you got to have a good person that understands that too.
That's true.
I feel, I don't know if you feel like the same way, but I feel like nowadays us physicians get a bad rap.
And how so?
I just feel like out there, a lot of people feel unheard. A lot of people feel like the medical community isn't really like treating them or listening to them. But I feel like a lot of times we can't explain our side either. That we've spent a long time in school. We've been studying for a very long time. We know the science behind things, but I feel like there's a lot of distrust and mistrust in doctors and physicians nowadays. Do you feel like that?
Yeah.
Like before, I feel like your doctor would tell you, hey, this is what's happening, here you go.
Yeah, I do.
Feel like medicine's changing a little bit now, and a lot of mistrust with the doctors and the medical system and fear.
I do, but I have a little different opinions about that. I think that some of that, especially with the COVID and all of that, I feel like some of that mistrust is warranted. Meaning, I think
for sure.
Yeah, I think we gave when you give people wrong information or you promise them one thing and they don't get it, right, there's going to be mistrust. And I've always said that patients do need to take more of responsibility in terms of taking charge of their own medical health, right? Like in my grandma's time, she just believed the doctor.
Right.
Whatever the doctor told her, she would do. But unfortunately, not all doctors are created equal.
It's true.
So patients have to do their due diligence.
They do.
Have to, they should get second opinions, I think.
But I also want to tell people there's good doctors out there.
There are excellent doctors out there.
Doctors that care and try our best, and we fall short.
Well, I think there are excellent doctors, but I think
there's definitely
and the problem for the consumer or the patient is that they don't know who's who.
Right.
And so that's what hopefully these kinds of programs will help elicit is, you can hear some opinions from experts in the field.
Yep.
And as our disclaimer says, this is not necessarily medical advice that's right for you, but you need to listen to what people are saying. And
take it or leave it.
Take it or leave it. Ask your doctor about their opinions. Yep. And if you're not getting the answers that satisfy you, you should ask another doctor.
True.
Right? That's what we're here for. I think any good doctor should not be afraid of their patients asking for second opinions or third opinions because, we all know that we don't have all the answers.
Yeah, it's true.
Yeah. Well, what do you hope to get out of this podcast, or what do you hope that this podcast gives to the listener? Again,
I hope it's just to give the listener some information, and again, they can take it or leave it. I got to be honest, I was hesitant to do a podcast because I don't know if everybody knows this, but you and I are probably the most two private people. Oh, you're not private?
No, I think so. Yeah.
Okay.
Yeah.
Oh, I private.
Yeah.
Yeah. I don't like people know my business or be out there, So
yeah, I think
just
probably me too.
Like my little, I do what I do, and I just, know.
And Hawaii's so small that people know us or know of us.
They do.
Just because family, friends, et cetera, et cetera. And, you kind of put yourself out there.
You do. So it's a little bit unnerving for me in that sense. But I felt like it was really important that we do this just to get the information out there and for people to, What
I was hoping was that I think the problem that I've seen in Hawaii is that people don't know that we do have excellent doctors in our community. I mean, really.
We do.
And we're lucky that most of the doctors are from here.
Yes.
And that's the reason they've returned.
Exactly.
Because if they weren't here, like for example, if my whole family wasn't here, why would I work here and make less money?
Exactly.
And have a super expensive cost of living? I could be living somewhere else and I can buy a vacation home in Hawaii and come here whenever I wanted to, right?
Yeah.
Why would I choose to live here? And I think people don't realize that we have some excellent, I feel we have some excellent doctors in Hawaii.
Like that too.
And I'd like to highlight some of these doctors and also pick their brain about some common medical things because I get bombarded with questions that I cannot answer from family and friends about who should I see for this or what should I do about this?
Right.
Or, mom is getting dementia.
Yeah.
What am I supposed to do? And there's so many common questions that I think we can hopefully gives people a starting point to just start thinking about and maybe some questions to ask their personal doctors, for advice.
Right.
So that's what I'm hoping to do is I just bring awareness to who's in the community.
Yes.
And maybe a little bit more information about some of these common health problems and questions.
You know very well what you do. I know what I do, but we don't necessarily know, even though we're doctors.
Exactly.
We don't necessarily know all the nuances that people
people think that
other physicians have.
Well, I know at least for my family, people think that, just because you're a doctor, you might know everything about theirs. And I tell them that. I'm like, ask me a question about your hip or knee, but
it's hard, right? Yeah.
I don't know what's happening with your stomach. You gotta ask another doctor.
I have no idea when they say anterior or posterior approach. I have no idea, right? So it'll be interesting.
Anyway, hopefully some of our guests will help with some of these questions.
And hopefully it'll be fun and something that people will
fun and interesting
want to listen to too. Yeah.
Yeah. Well,
here we go.
Yeah, I hope people find this podcast interesting.
Me too. In the very least, I think it's entertaining for the both of us. So
at least for us.
Just for two people here, it's going to be fun.
We'll entertain each other.
And Ryan maybe.
Yes. Yeah.
We hope you tune in the next couple of weeks, where we will be interviewing some really interesting guests and have some really good information for everyone out there. Hopefully it'll be fun and interesting. And
we're going to try to pick topics that are of common interest, like dementia and the aging parent. We were discussing about maybe even the problem of drug use in Hawaii. Well, because apparently we have a very big crystal methamphetamine problem here.
We'll do some arthritis, maybe.
Yes, we'll do talks on hip and knee arthritis and surgical treatment options.
Some obstetric and gynecology.
Yep, like the top 10 most embarrassing questions that you
are too afraid to ask your OB.
Which I'm super interested about.
I already have a box full from...
And maybe other common topics like testosterone, replacement. That's becoming a very common question, especially for older adults, et cetera. So
and hormone replacement therapies, things like that, I think are...
ACL injuries in the high school athlete, because so many kids play sports and get injured. So we'll have some... sports specialists, orthopedic surgeons that we can talk to about common treatments, etc. So anyway, stay tuned and we hope you guys join us for the next episodes.